In my personal and professional experience, you can probably fix that lower back pain for good. Hey guys, my name is Francesca. I'm a registered kinesiologist and a personal trainer, here to help you find your personal exercise prescription to improve your posture, pain, and your performance. In today's video, we're talking lower back pain and how you can manage it using evidence-based protocols. Now, there are a number of exercises and stretches that I can just throw your direction and hope that something sticks. But the more efficient and better approach is to initially have an assessment from your movement professional. I do free 30-minute one-on-one online consultations, and I'll link that in the description box below if you're interested in working one-on-one together. If you don't have the liberty of getting an assessment done, then one thing that I can tell you that will absolutely make your lower back pain worse is to absolutely do nothing. Studies show that sedentary behavior or complete bed rest can actually make your lower back pain worse, and it simply prolongs your recovery. Motion is lotion and exercise is medicine, so we definitely want to promote as much movement as early on as possible. Now let's first take a look at some of the possible reasons for your lower back pain in the first place, because depending on the mechanism of injury, that will dictate what your exercise prescription should be. Please stay tuned to the very end of the video because we're going to get more and more specific about certain lower back conditions. Now, with any of these lower back conditions, you may have difficulty bending down to pick something up off the floor, getting up out of bed, and even sleeping. With lower back pain having the ability to wreak absolute havoc on your day-to-day activities, it's really, really important to have a thorough approach. And even more importantly, to stay positive through your recovery process. We have to manage your expectations from the beginning, and this can help you avoid any unnecessary anxiety and even depression when it comes to your lower back pain. But you do have to understand that you can't come back so much stronger from this. And then oftentimes I find personally, professionally, most patients have an appreciation of the privilege that comes with being able to move pain-free, as well as getting back to the things that you love to do on a daily basis. Now let's break down some of these potential reasons and what we can potentially do for this lower back pain. Now, while there's a lot of possible reasons for lower back pain, let's cover 3 of the most common. First, one of the more common reasons for lower back pain is either a sprain or a strain to the lower back region. The difference between the two is that a strain involves muscle tissue and that a sprain usually involves the joints and/or its associated ligaments. With this type of injury, your lower back pain can be considered either acute or chronic, where with an acute injury, that onset or it happened within the last 72 hours, and it's usually the result of one significant event. So for example, lifting something heavy and you suddenly feel a sharp pain, that would be considered an acute injury. Chronic injuries are the result of compounded stress that has occurred over a significant period of time, where there might not be a sudden onset or we don't really know when the symptoms first began. This stress just occurs repeatedly over time. Speaking very generally, your exercise prescription could look like, first, managing the pain and inflammation, 2, gentle stretches and gentle mobility exercises for the area, and then 3, strengthening all associated musculature, including the deep core, glutes, hamstrings, adductors, you name it. A second reason for lower back pain, and one that I tend to see most commonly in my practice, is poor relative posture. Now, I have to say relative because there is no perfect posture, but per the individual, their posture is not ideal for their day-to-day activities. Poor posture can look different on everybody, but what I tend to see is lack of movement variability in the pelvis and in the rib cage. For example, being stuck in anterior pelvic tilt. This usually results in lordosis or an excess lower back curvature, which can approximate the abdominal musculature, meaning your core muscles are getting weaker over time because they lose their mechanical leverage because the pelvis is stuck in anterior pelvic tilt. This also can lengthen associated muscle groups, for example, the hamstrings and the glutes, which is providing further instability and weakness to the whole core system. Lastly, this presentation can cause reduced intra-abdominal pressure control, and add further strain to the lower back and the lumbar spine. An example of an exercise prescription here could look like inhibiting and or loosening the lower back and stretching it, strengthening the core muscles, including the deep abs, as well as important hip stabilizers. Improve the ability to manage your pelvic orientation, so learning how to posteriorly tilt your pelvis, which is a necessary movement capability. And this is going to give you more movement variability for all of your daily activity. Teaching your body to manage itself under the forces of gravity is going to give you the best optimal posture for your daily activities. Being able to withstand all sorts of postures that you endure on a day-to-day basis should be your long-term goal. The third and final reason for your lower back pain tends to be a little bit more complicated, and this can be the presentation of any sort of arthritis or pinched nerve. Herniated discs and sciatica continue to present a host of symptoms which can be difficult to manage from person to person. Now, these conditions require often diagnostics such as an MRI or other imaging to help you come to that conclusion that you do in fact have a pinched nerve, for example. But the disadvantage here is that it often takes a long time to get these images scheduled. And while it is helpful to have that imaging done, you're left waiting until you actually get the MRI and you're in pain and unable to really move forward or pursue any sort of therapy until you have that diagnosis ready. Regardless of the diagnosis, improving your strength, stability, and retraining your movement patterns is going to be your long-term goal and the key to managing your pain. As these conditions are a little bit more complex, a general prescription here could look like, first, managing the level of impact. So for example, no jumping and running until pain is managed. Improving your core and your overall strength. Managing your stress, as well as performing good mobility exercises to help you again improve your movement variability. Now that we've gone over the potential reasons for your pain, let's review a more specific exercise prescription for all of these conditions. So with the first reason that we were talking about sprains and strains, we reviewed that a general exercise prescription would be to initially help manage the inflammation and pain. This may have you reaching for the anti-inflammatory drugs, but this is actually no longer recommended. Things like aspirin and Tylenol will simply mask your pain, leading you to think that you're better when you're actually not. Instead, these other means will have your lower back feeling more protected against further injury or aggravation. Once the pain and inflammation is managed, gentle mobilization is great. Now, moving forward, if any exercise gives you pain or aggravates your symptoms further, you should either scale back or completely stop the exercise and then consult a movement professional. For a gentle mobilization exercise, I do love lumbar cat camels for this reason. On all fours, you're gently mobilizing the spine, allowing it and promoting it a little bit more mobility safely, while also working the deep abdominal muscles and the pelvic floor. The lower back may feel a little sticky, then you know that this is an area that requires a little bit more motion. You should feel the core working really well with this exercise, moving really, really slowly and breathing well throughout the entire exercise. You could do one set of 15 to 20 reps. But almost with this exercise, you can probably do as many reps as you like. Hip hugging is another fantastic example of an exercise that helps to gently stretch the lower back and putting it in mild flexion. Putting it in mild flexion may be alleviating for your lower back symptoms. Making sure that you take deep breaths as you perform this exercise. And this can be held anywhere from 30 seconds to a minute with both legs or one leg at a time. Now with lower back pain, you never want to loosen the area and then not do any core work to supplement with that. The back muscles are really tight because it feels that it doesn't have enough stability to begin with. So we need to retrain that stability using the core and core stabilizers. Dead bugs are often prescribed in physiotherapy and chiropractic care because they work the transverse abdominis muscle, which is your deepest ab muscle, and one of its main jobs is to assist in stabilizing the spine and protecting the pelvis. It also assists with breathing and bracing your core strength. So it makes sense that this is a perfect opportunity to also practice good respiration while training the transverse abdominis. This is a key thing that I find a lot of people miss. As you're performing dead bugs, your main goal is to keep your pelvis and your rib cage still as you move your limbs away from your midline. You're inhaling as you bring your leg back to the start, and then you exhale as you lower your leg away from you. And the great thing about dead bugs is that there's so many variations from complete beginner to absolutely advanced fitness level. So there is room for progression with this one. Speed accomplishes absolutely nothing. This exercise is all about control and engagement. Now with core strengthening, it's not just the transverse abdominis that we need to be concerned about. This also includes your obliques and your erector spinae muscle group, which is your lower back. All of these muscles work together in a system to help promote overall fluid movement. Therefore, introducing the McGill Big Three exercises, which include the side bridge, the McGill curl up, and the bird dog. These exercises were coined by low back researcher Dr. Stuart McGill. He expresses that these three exercises are super important for generating core stiffness. This essentially teaches you how to stabilize and how to breathe and brace through day-to-day activities, including exercises such as squats. These exercises are fantastic. I definitely give them to my clients a lot. If you're interested in looking at the tutorial, they are all linked here. One of the final pieces of the equation when it comes to strengthening and managing your lower back pain is to not neglect the glutes. I'm going to talk more about the glutes, hamstrings, and other muscles to be strengthened in the other recommendations and exercise prescription. If your lower back pain is due to poor relative posture, for example, you may be exhibiting an anterior pelvic tilt or a sway back, rib flares, and your low back just gets really stiff from sitting or standing long periods, then you want to address the position of your rib cage to the pelvis. You could go ahead and strengthen the glutes, hamstrings, and core, for example, but without addressing the relative position of your rib cage and pelvis, the results are only going to last short term. This is because the muscles will lose their mechanical leverage for as long as their muscle attachments are so far apart from one another. Optimal alignment will allow these muscles to function well, and they will also coordinate with one another as a unit. This is why I love exercises from the Postural Restoration Institute, because they address the common culprit, which is the diaphragm. The diaphragm muscle, like any other muscle, can become weak and super tight. And due to where it's attached, this tightness can influence posture over time. For example, a really tight lower back. By using postural restoration exercises such as this one, I can inhibit and relax my lower back and pull my rib cage back over my pelvis. This will help me engage my core, loosen my diaphragm, and improve my breathing all at the same time. This exercise is super challenging because neurologically you're trying to tell your tight muscles to relax and trying to wake up the muscles that have been asleep. Depending on the individual, other postural restoration exercises may be warranted, in addition to following up with other core strengthening exercises. For strengthening the hips and managing this anterior pelvic tilt presentation, glute bridge and its variations are classic because they work. They're also an essential movement pattern for day-to-day life. Anti-hip extension exercises, such as an ab pullover, are also fantastic because they're going to challenge your endurance in hip extension, where you have to keep your hips extended without resorting to arching the lower back and disengaging the core muscle. Copenhagen plank variations strengthen the core, but they also bias the adductor muscle groups or your inner thighs, which are again an often neglected muscle group when it comes to managing lower back pain. In this exercise, you're performing a normal side bridge, except the top leg is straight, where you're gonna use that top leg adductor muscle group to help you lift your hips off the floor. This exercise is fantastic, and I have the tutorial here for all fitness levels. The third and final exercise prescription that we're talking about today, where the cause of your injury could be due to a disc herniation or a pinched nerve, because these are a little bit more complex, you definitely want to go with the guidelines prescribed to you by your movement professional. And due to the complexity of these injuries, it is difficult to come up with a more general exercise prescription, but I will say this: complete avoidance of moving the spine is not ideal. It makes me think back to a client that I had where he had a pinched nerve and he completely altered the way in which he would pick up a paper off the floor, legitimately using his toes. It's not sustainable in the long run. It just isn't. Your long-term goal should be to be able to restore the range of motion that you currently don't have. So if touching your toes is impossible right now, that lack of movement variability is going to hinder your day-to-day activities. So your training should involve trying to touch your toes. Also, what's often coupled with lack of range of motion in the spine is a lack of rotation in the spine. Here are a few ways in which you can gently mobilize the area to be able to flex the spine as well as rotate the spine. A gentle and relaxing stretch would be these supine trunk rotations, where you're laying on your back with your knees together and your arms are outstretched to your sides. You want to try to lightly engage your core and gently inhale as you very much so slowly drop both knees to your left side to start, for example. The goal is to try to do this without arching your lower back and keeping your core engaged throughout. You don't want to push range of motion that isn't quite there yet. You want to go as far as you can and then slowly exhale as you return back to the start and simply alternate between side to side. Another exercise that many people find helpful with these conditions is the Mackenzie lower back extension. This is to help you increase your tolerance with hyperextension of the lower back. You can start by simply laying prone on your stomach for up to 1 minute, and then you can progress to slowly coming up on your elbows, exhaling as you do so for approximately 10 reps. Now, while you may not be able to tolerate spinal flexion just yet, it should be something that you work up to. Spinal flexion tends to be a trigger for those with these type of conditions in terms of their disc. So you want to work with your movement professional to determine your rate of progression. You can start with something really simple, such as a cat camel on all fours. This is a really popular exercise where you're trying to integrate the abs with spinal flexion, where you can gently hold this pose and perform repetitions. This can be progressed to exercises like static beast and eventually a Jefferson curl, where under load, you are maximally flexing the spine. This is also working your pelvic floor and your hamstring, so it's not just the lower back that's being worked here. Remember that with all rehabilitation programs, some discomfort is to be expected as well as warranted. And it's for this reason that you always want to perform every exercise with control and at a slow pace. That way you can gauge your tolerance to the exercise. Always breathe well through every rep, and the moment that things start to feel a little bit uncomfortable, you can stop and scale back, or this is probably your sign to consult your movement professional for additional help. I hope that today's information was really helpful to you to manage your pain. If so, do like, comment, and share this video so that it can get to people who are in need of this as well. If you need further customized help, just as a reminder, I do give 30-minute free online consultations, and the link is in the description box below. I also have an entire exercise library where I'm adding exercises as often as I can, including some of your favorite core exercises and mobility exercises, and you can also find that in the description box. Thank you so much for watching. Have an awesome day and happy training. See you next time.